Hey, howdy, and welcome all to the Big and Bright Podcast. My name is Nick. This here next to me is James.
Howdy.
Friends, we have a lot to talk about.
Not really.
And at the same time, only one thing to
just
talk
one.
about.
Just one thing.
So we have a lot to talk about one thing. And James, what is that one thing?
Rona. As usual.
I thought it was going to be Christmas.
No.
Because
Sorry.
Christmas isn't over.
Yeah.
Christmas isn't over. You should still be listening to Christmas.
Protestants, it's over.
You should still have Yuletide. Protestants should celebrate Epiphany. I'm sorry, they should. Right?
No,
it's an excuse to continue Christmas and eat cake.
When I was driving over here, the funniest thing I noticed is, man, those who were so quick to put up those lights are usually the ones who kind of edge toward February before they bother taking them down.
Take them down.
So it's like, wow, you're really quick, and then you just forgot, got lazy.
You know what? If you go with the 12 days of Christmas, now you have a reason.
Sure.
Right? So again, I really think.
Wow, Americans found another way to be lazy. I'm so shocked.
Hey, they found another way to be happy and joyful. And
That's not how it seems.
Have Yuletide joy.
That's not how it seems right now. They're going crazy.
There's this guy, and you can, whenever you come over to my house, you pull in. They've got like a lot. They've got like Griswold level lights.
Oh yeah, I know.
And right now. It's all their stuff's knocked over because like this big wind tunnel came through and all their stuff. Yeah, the reindeer
80
scattered
degrees
everywhere. Yeah,
yep, 20
exactly. Welcome to Texas, friends.
Yeah,
where the weather is bad and the Rona testing is.
So, would you say the weather outside is frightful?
Yes, right. Well, you know what I would say.
What?
I'd say maybe it's cold outside.
Oh, that's for a different person. I am not your wife.
That's true. I
will put down this drink and just go home.
But I love that song. I love that song. It's an amazing song. It's a great song. Anyway.
Fine.
Point being, the Rona testing in Texas has gotten a little
ridiculous.
Tight. I don't know if you've seen the massive car lines outside. There's a church not far from where we are right now.
Yeah.
And I think you know which one I'm talking about. It's right across from the racetrack. And they have signs outside that say free COVID testing. Big signs say free COVID testing. There's always a
sold
line
out.
There's always a line wrapping around the building.
Yeah.
Right? Because everybody needs to get tested or they can't go to work.
See, okay, that's the silliest thing. Like, if you're asymptomatic, stop, test. Like, it seems now it's like if I have any sort of sniffle, I better get tested because I saw an AP article a few days ago. It's like, hey, this could actually have flu-like symptoms or cold symptoms. So here's a way to differentiate. It's like, if I have to be confused if it's a cold or a flu, maybe it's actually not that bad.
Here's the question as to whether or not you should go to work. Ready?
Yeah.
Ready? Are you sick?
No.
Then go to work. Are you sick? Yes. Then don't go to work.
Or
it really
work remotely because everybody's figured it out. Like, all right, there's no excuse now. Get to work. Let's go.
It really should be that easy. Yeah, and I've been working. We've been working remotely since 2020.
Yeah, well, I haven't, but
we figured that stuff out.
Well, anyways, the reason why Texas did, or why we're talking about this for Texas, this is a nation thing, really, because Biden promised to have testing pretty much day one, and then all of a sudden he got surprised about Omicron. I was like, so you didn't have tests? Fine, whatever. But anyways, Abbott had a request testing sites for Texas from the Fed. Yes. We know it's from the Fed.
It's all from the Fed.
But it's because a few counties, they selected those for extra testing sites because of the positivity rates and hospitalization levels. However, hospitalization levels really aren't that given because they really can't tell who's there because of Rona or they have Rona, who's vaccinated and unvaccinated. The research is still not fully there. So hold your horses on blaming the unvaxxed, like apparently everybody wants to do.
Not to mention the fact that this is the time when hospital rates go up anyway.
Yeah.
Right? You see more people in the hospital anyway because the weather changes.
But what about those death rates? Have they gone up?
No.
Yeah, I didn't think so. Yeah.
They've gone
weird.
the other. What's the opposite of up? It's down. Yes,
down or stagnant, or where you can look at the country, which is highly more unvaccinated than we are, South Africa. Mm-hmm. Oh, that's
and they're fine.
Look at that. That's weird because I thought the vax was going to super duper save them. Yet they're not that vaxxed very well, and they're just fine.
Which, by the way,
kind of weird.
This is sort of an aside, but when we had Delta, right, there was this whole fight.
We did have Delta.
Yeah, we did. We both had Delta, which, by the way,
allegedly
way worse than Omicron. We have a mutual friend who hates when I call it Omicron.
Is it Omicron?
It's Omicron. Its pronunciation is Omicron.
Well, when Biden first mentioned it, I think he said Omicron.
Omicron.
So,
well, the thing is,
because he's with it.
So it's Omicron because in the Greek alphabet, there's actually another letter for the O sound. It's omega.
Yeah.
Right. And so
to
call it Omicron doesn't not only is that wrong, it doesn't make any sense.
It's basically America saying Iraq. It's like, right, that's how our language works.
Yeah.
Well, it's actually Iraq. Yeah, well, over there, they can call it whatever they want. Over here, we have I. It says I here.
But, okay, so back to my point about Delta, though. When we had Delta, there was this big fight over whether or not we should call it the India variant.
Yeah,
right?
that was
because,
for me.
Because it was the Chinese virus, then it was the India variant. But then when we get to Omicron, Omnicorn,
whatever,
nobody calls it the South Africa variant. Have we just sort of given up on that?
The first time they did it, I remember
I
I was talking to a family member of mine because when it first came out, I was like, "Oh wow, wonder where they're going to do this." Because it was like B.1.7. These weird, like basically UPC for the variant, and then it's like, "All right, it's just Omicron."
Yeah,
because they had to skip, by the way, 2 letters.
Yeah, I was gonna say there's letters between Delta and Omicron. I know that. Right?
Yeah, they skipped 2.
I don't know. Yeah. Oh, because of because they didn't want to call it the new variant,
right? Because they said it could confuse people, and I'll give you that one. Like maybe it's the new variant. He was like, "Well, which one? Well, which one?" But then they had another one. It was spelled XI. Oh, it doesn't. It's not pronounced G, but
that's how it's spelled.
But it's spelled like it, and the WHO...
It's actually pronounced key.
The WHO...
So again, that's an American thing. It's pronounced key.
Well, when you're in Greek, yeah. Definitely isn't owned by the Chinese. Mm-hmm. But the WHO is the one who skipped over the one that kind of would make the Chinese guy... I'm sorry, president. I've never known a president have very authoritarian powers and to never be elected out.
This president has served for a very long term. Yeah.
And has a very hard thumb. It's almost like if you dissent in Hong Kong, you just go to jail for what? You ask one more question, you may not come out of jail.
Right to jail.
Right to jail. Yeah. But anyways, back to the thing. 6 testing sites were approved for Texas from the Fed. Okay? That's where going back to the original story, because you went a little tangent on Delta. I let you have it.
That's what makes this show interesting, James.
Sure. Mm-hmm. Anyways.
You think it's all this data that you throw out there?
Yeah, all this data that is true. Abbott also is asking for more monoclonal antibody treatments, saying that the Biden administration has cut supplies of the treatments and testing kits when they're needed the most. Why are we so low? It's so weird.
Yeah, because we had a surplus for a while.
Yeah,
it's monoclonal antibody treatments when it was being super regulated.
Well, also states had power.
Yeah.
To purchase it easily. The Fed took over.
Not even the states, the hospitals had power to purchase them as needed.
Yeah, you would think like, hey, I'm on hospital staff. Mm-hmm. We need 10. Here you go. Are you sure they need 10? Why would this nurse or doctor, whoever lied? Like, are you kidding me? Like, they have no reason to lie. Hey, we need 10. We need 10.
More importantly, why would they spend extra money that they don't need?
Yeah, exactly.
Trust me, I know hospitals. They're all about being stingy with their money.
But no, what happened is that in September, President Biden, during the Delta surge, which you were mentioning, they changed the rule to now the Fed does it. Well, this is apparently a Washington Post.
Did they change the rule, or did they just buy up all the doses?
Yeah,
that's more what they did.
Yeah, right? that's they're going around the fact that's exactly what they did. But even in Washington Post, they admit it was all but certain to result in cuts of the medication in some states, especially 7 states in the South. The Department of Health and Human Services will at least temporarily set the rules for distribution. And instead of allowing the states and the facilities, like you said, to order them directly. I'm still waiting for that temporary thing to end.
Yeah.
Because it seems like it's not stopping. I think it was Ronald Reagan who said the closest thing to everlasting life on this side of heaven is a temporary government.
It's temporary government action.
Action. Yeah, it's never stops.
There's death. There's three things that can be assured: death, taxes, and the fact that temporary is not in the government.
Well, there's actually four, and dead people still vote Democrat.
That's true.
So, anyways, the HHS will determine the amount of product each state and territory, because for some reason we have to keep territories, receive on a weekly basis. Again, HHS, because as we've all known, federal government's never gotten it wrong.
Yeah.
But this spokesperson said the health departments will subsequently identify sites that will receive product and how much. But the official spoke on the condition of anonymity because of how bad the program's going. And, of course, we get back to the word for the woke. It's equitable distribution. What does that mean? Yeah.
So there's some state that I heard about. It's either a state or it's a particular hospital that's stating that we need to allocate doses of the vaccine as per, based on need for pre-existing conditions. And they also, in that same statement, classified not being white or being non-white.
Oh, no, I think I know what you're talking about. That was the monoclonal antibodies,
yes.
And that was for New York, yes. Which is on their own New York State post saying, yeah, if you're white, you're kind of in the back of the line.
Being non-white is a pre-existing condition. By the way, obscenely racist.
A little bit.
But
a little racist.
Yeah, it's like,
But I mean, it's different, Nick. It's against white people, so it's fine.
Here's what drives me crazy about this, right? So we expect the equity. We expect all of this extra, all this.
I don't expect equity. It's a made-up term, but yeah.
From the administration,
yeah.
Right? You expect terms like that. You expect all this woke nonsense, and by the way, you also expect incompetence when it comes to distributing things like monoclonal antibodies. Here's what drives me crazy, and this is why I mentioned it earlier. They bought the doses.
Yeah.
That's how they did this, right?
It's mine.
It's not like they said, it's not like they just passed a law to say, okay, we now get to control how this stuff is distributed. It wasn't a piece of legislation. They just purchased all of it. With what money?
Ours.
With your money.
Yeah.
So
they spent state taxpayers' money
paying for this incompetence.
For the state to not be able to save their taxpayers.
Yeah.
Because it's also been used for people who are partially vaxxed, not just unvaxxed. So again, before you blame all the unvaxxed, it's not what the reports are showing.
Yeah.
At all.
This idea of this is now a pandemic of the unvaccinated.
No, it's not.
It's not true. Not anymore.
No. Well, they flipped it. They flipped it. Remember, it was adults need to be vaxxed because you could. Or no, I'm sorry. Yeah. Adults need to get vaxxed because, especially teachers, because the kids could give it to you and you could be passing it. Well, now it's the adults need to get it because you could pass a shot to children who still under 700 people who died the whole time. And 20
in a 2-year pandemic.
And 20 of those actually had non-pre-existing conditions. So the rest of them is like, yeah, you got dealt a bad hand. We also haven't, really broken it down by age group, broken it down by what do they have, were they overweight? Because now CNN is finally saying being overweight probably is not good for you. We've been saying this from the beginning. Like, it's so awesome. I finally put the tinfoil hat and go, okay, so I'm actually at the same table again. Here we are.
So why... Oh, so while we're on that, let's discuss this, because here's the thing. We've been sold this sort of fear tactic of you're right, Omicron is really transmissible. Yeah, but nobody's dying. But what if there was one that was just as transmissible? Okay, what if I get eaten by a shark, right?
Yeah.
What if asteroid, right? That we can't live our lives like that.
No,
but that's been what the media has been doing up to this point. And I don't know if you noticed, but they've kind of switched. They've kind of shifted.
They're hoping you don't notice. They memory hold a lot.
And I know, so we use terms, and I'm very guilty of this. You've made fun of me about this on this show.
Yeah.
We use Orwellian a lot. We talk about things from 1984, right?
It's a book.
The term memory hole comes from 1984.
Yeah.
Right? That's an Orwellian term.
Basically, the biggest one, when you first get brought into it with a book, the guy, he works for a newspaper. Sorry, we're getting kind of in the weeds here, but I have to explain. The guy works for a newspaper.
Oh, I'm going to keep talking about it.
Yeah, the newspaper, his job is to take what they give him, say, hey, we said this 2 months ago, 6 months ago, whatever. We need you to change it. And the original, we just need you to put in the memory hole that way. And our directions to change it puts the memory hole that way. You don't even remember what you changed. When it happens so often, you don't have anything written down. You don't even remember what you changed to make to the present. So we said we're going to sell 100 million boots. We only sold 50 million. Go back and change it. See, we said 50 million, and look at that. It's 50 million. We've been right consistently the whole time. Yeah. That's basically what memory holding is. You're never ever wrong because you just change the terms or just change your news like that.
Not only that, but in this book, there is a scene that indicates how well the government/media propaganda machine has trained the population to the point where there's a man giving a stump speech about a war that's going on, right? And in the middle of his speech, the enemies switched.
Yeah.
So we're no longer at war with these people. We're now at war with these people. And a man comes up, whispers in the guy that's speaking's ear, and he just shifts it and starts talking about the other nation. And people like pause for a second.
It's double think.
And then they just go on.
They're like, wait a second. No, if we question it, we're in trouble.
Which is very, and I mean, obviously that's not literally what happened, right?
Yeah.
They didn't do that. But this is very close to that.
No one's going to beat down the door.
Because you were talking about this stuff, right? This concept that this isn't as bad as it seems as a conspiracy theory. And I'm not kidding. Yesterday, you were talking about that, right? This is something that has changed in a matter of days, right? And in some cases, in a matter of hours. And it's people who have been like harping on this over and over and over again, that if you say that the vaccine isn't necessary for people who are young and healthy, if you say things like this is basically just a cold, and it's while the initial variants were dangerous, these new variants aren't as bad. When you say
kind of a
like
godsend.
that, yeah, when you say stuff like that, you were called a conspiracy theorist, and it's now we've shifted it, and people are just talking about it like you said, like you're just expecting us not to notice.
Yeah.
Right? That we're just going to keep.
And most won't, because they don't really pay attention to it. Like, as no one really reads the boring news like I do, like really meticulously. I'm going, wait a second.
And nobody watches Don Lemon because you can't suffer through that.
Yeah.
Or Anderson Cooper. Goodness. Anyway.
But, yeah, that's basically what's going on right now. I mean, we're getting to some other stuff that's like kind of changed in this whole time frame, and they're just flipping on a dime. And expecting you to not recall and not to play the same videos that are still available to watch them. Say like, well, what changed here? Nothing. But you changed your mind. Yeah. All right.
That's not what they would say. I imagine that's not what they would say. If you say you changed your mind, they say no, I didn't. I've always thought.
Well, the science evolves.
Oh my gosh.
Yeah.
Okay. Was that you just tried to Fauci?
Yeah.
You tried to Fauci.
Still better than yours.
And you did worse than me.
No, still better than yours.
No, you did way worse than me.
My mom disagrees. She already votes me up.
That was... Oh, man. Your mom is the only person that would think that's
anyways.
Fauci. Go ahead.
Okay, so the mainstream overlords have finally started to wake up to reality, as we've kind of breached into. But it only took 2 years, finally, because we were the tinfoil hat wearing sons of guns, all right? And yet, here we are, 2 years down the road, CNN finally saying, yeah, cloth masks don't work. And they really haven't worked. Just changing their tune now with Omicron, okay. Well, it's according to Dr. Leanna Wink, she actually is a real doctor.
She's a medical analyst on CNN.
Exactly. She's saying cloth masks are a little more than facial decorations. Have been that way. Because she didn't say it changed because of this. She's like, no, that they've been. And she then went on to say, scientists and public health officials have been saying that for months. What?
No.
You've been awful quiet.
Yeah, I was going to say, they've been
awful quiet.
They've been whispering that if they said it at all.
Because all I've been told is wear the dang mask because it's going to save your life.
I think that what we're going to see, because they're going to get called out on this, right? People on the right-wing media, or people that are more...
Well, then let's play it like Clinton. That's old news. Why are you talking about it now?
Well, I don't think that's what they're going to do. I think they're going to put it on this new variant. I think they're going to put it on Omicron. They're going to say, yeah, we said all that, but that was Delta. That was the initial variant. That was the initial COVID variant. Now we're talking about Omicron. Omicron's not that bad.
Well, Biden just did a friggin' interview about the emergency crap. He still thinks we're in 2020.
I don't think Biden knows the agenda.
I think he's literally that guy in the scenario you were talking about. Someone just whispers in his ear, and he's like, "All right, yep." Mm-hmm.
I don't think he knows.
He has no idea what's going on.
I don't think he knows what to say until like I think he's briefed 10 minutes before, and they just kind of roll him out there and say, "Read the prompter, Joe."
But then he'll read the entire prompter and it's like end of message.
No, he reads it and he whispers in that creepy. Have you ever seen that? About the variants. You need to do it. You gotta get vaccinated. Come on, man. What is wrong with you? That is so creepy. That's hair sniffing creepy.
Just give him a Hall's tab. I bet his voice is just hoarse. He talks more than 2 minutes. Dude's so old he can't keep up.
I genuinely don't think he knows what to say.
But right, okay. So sorry.
Long.
Back to the story.
Yeah.
Again, this person. What's her name again? Dr. Leanna Wen. Doctor. Come on, man. She earned it.
She's
real.
Following up on you. She's real.
She's real. She's a real doctor. Not like Jill Biden. Anyways, N95 mask should have been used, which is what we've been saying the entire time. If you're going to wear it, actually wear this. Since you weren't willing to wear that, then we're done.
Yeah.
But no, because during the first several months of the pandemic, health experts discouraged the general public from buying the N95 mask since medical professionals were facing a shortage of personal protection equipment.
Let me note.
Sounds familiar?
Yeah.
Sounds a little familiar?
Sounds that if you can try your Fauci voice. You want to say that in the Fauci voice?
I can't do Fauci.
Do it, James. Do it. So
what was his actual quote? It may stop a little 1 or 2 droplets.
It may stop a droplet.
Yeah.
No.
But it's not that effective. 2 months later, it's effective. What changed? Government said so.
Here's the next pivot. I'm calling it right now.
Okay.
The next pivot is that people are not... So we're going to say, cloth masks, right? Or surgical masks, not good. They are saying that maybe surgical masks can help, right? But N95 is the big thing, which we've been saying that from the beginning.
Which China has been faking and making counterfeits the whole time.
The next shift, when we can't explain why the N95s aren't working, because make no mistake, this is an airborne virus. You're not going to be wearing an N95 100% of the time. This is
also not properly.
Yeah, this is going to spread, and that's it. That's what they're going to say. They're going to say, well, no. It's not because the N95s don't work. It's because you're not wearing it properly, which you're probably not.
Right, unless you're a doctor and know how to get it fitted. By the way, if you have a beard, you're never wearing it properly, ever. Yep. Any facial hair, you can pretend all you want to. You're not wearing it properly because it doesn't seal. Also, unless you have the funds to pay for it every time you use it, you have to dispose it. Mm-hmm. No one has that money.
And you have to get tested. So there's a you and I both know a nurse who wears N95s all the time. And when she goes into like a clean room, you have to like put it on and then you have to move your head and like recite like they give you a script to read and they have to measure the amount of spit that's coming out of your mouth or going back in. That's I mean, you're not going to do that every single time you put it on.
No, but you know why she does it?
Because she's a professional.
Right. That's why she does it.
This is and this is the thing. That's the next thing. Yeah. The next thing.
Everybody needs to have a nurse or a doctor class.
It's not the mask. It's you. It's you're not wearing it right, which you're probably not. But the fact is, it is the mask who shouldn't be wearing them. It's this whole thing is.
No, just get over it. Good golly. It's been over. If you're vaxxed, you're over. Because now they can't even differentiate between vaxxed and unvaxxed in some certain situations. And even Fauci came out about a week ago saying, okay, so children that are in hospitals with the Rona aren't there because of Rona. A lot of them are there and just happen to have Rona. So quite a few got it after already being in the hospital. Oh, again, 2 years later,
that sounds very familiar.
Oh man, it's almost like we could be in trouble for saying that. But you got it. But
very familiar.
Even when I looked up, by the way, Fauci lying because he ended up saying, "Well, I did it because I want to make sure healthcare people had it." I looked it up on Reuters because they're left wing and they're very for Fauci. The fact check even said it's partially false, only because the government hadn't recommended the use of masks yet. Okay?
Well, now they do recommend using
masks. So it changed.
Yeah.
But wasn't he the guy they were listening to?
Well, yeah. I mean, he's the head of the CDC.
Or NIH or whatever.
Whatever it is. Right?
Either way.
He's the head of something. All I know is
until the government recommends it, then it doesn't matter. He's the most
highly paid member of the government. Yeah. That's all I care about.
Over $400,000 a year.
That's yo money too.
That's yo money. Because I don't pay taxes. Oops.
Taxation is theft.
Jim. Yeah.
No. All right. Here's the thing, though. We should be concerned because there is an increase in positive tests.
There is.
Yeah. There's an increase in positive tests. I don't know why there would be an increase in positive tests.
Everyone's testing.
That's
why you're in a freaking car because you got the dang sniffles. You're like, I don't want to kill grandma. Grandma's triple vax, bro. But I'm gonna kill grandma. Oh, look at that. Grandma got it despite you even testing. Well, it must have been those dang unvaxxed people. She's been inside the entire time. I don't know what you're talking about.
Unvaxxed people, and this is crazy. Unvaxxed people with Omicron have a lower death rate than vaccinated people with Delta. Omicron is
weird.
it's not a concern.
But also, they haven't been able to differentiate either when it comes to the nasal patch. That's how they still get it, by the way. They pretty much stick it into your brain, most of them, and then they get a little out. I'm going to guess, because I don't absolutely know, but I'm pretty sure that it just picks up what's in there, dead or alive. Mm-hmm. So if you have a dead Omicron variant,
can still be picked up.
It'll give you a positive. If you have a live one, it'll give you a positive. Mm-hmm. Also, when I got my test done, I listened to a guy babble on for 3 minutes before he gave it, because he didn't want to say this thing's absolute. Come on, man.
It's not.
I'm going to use Biden's term. Come on, man.
Oh, man. But the reality here is that you're taking more tests. You're going to see more positive results.
Right, and here's my theory on this. I don't know if Delta or the original was actually worse than what we have now. Because all we saw was the deaths. And again, those are kind of spotty, because a lot of them now, even New York's having to say, all right, so maybe we inflated it a little bit. Yeah, you did. Yeah. I think people who just had Rona didn't die of Rona.
That's not the news. That's the governor of New York.
Yeah.
Saying that.
But I think that because the whole thing in the beginning was, one, respirators, and they stopped talking about that real quick once Trump gave it to them. Mm-hmm. But two, we didn't have enough testing. That was the same trope when Biden came in. He said he was going to fix it. Newsflash, he didn't fix it. But I think more people do have available testing now. And that was the kind of the beginning thought, especially for people who are not taking it super duper seriously. It's like, well, there's not a lot of tests, so it could be up by a third or 2/3 of more people actually positive. We just don't have the testing.
It's not even just an increase in supply, though. It's also an increase in demand.
Yeah.
Right? This mandate has come down, and there's so many companies now that are saying, there are companies, and I'm not kidding, there are companies in Texas, and this drives me crazy that it's happening in Texas, that are saying, we want you to test, period, end of story. We don't care if you're symptomatic or not before you come into work.
Yep. Thought we had an EO against that. Guess that's not working.
Which is just, well, I mean, it's a matter of enforcement, right? It's a matter of how you're going to enforce that. So,
man, it's almost like I've been warning you about Abbott for a while.
Yeah, because Abbott's the one that's responsible.
He's the one who enforced it.
No, it's enforced at a local
Attorney
level.
General, enforce my law.
It's enforced at a local level, right? You have to. I mean, you
Attorney Generals literally bring local levels to court
over all the counties in Texas. I mean, and over all the businesses in all the counties in Texas. I'm just saying.
All it takes is one whistleblower saying, "Hey, they're making me do this." Wait, what?
The point is, this does happen, and the reality is that now there is no EO against people who are symptomatic, against testing people who are symptomatic.
Yeah.
And like you said, anything is symptomatic.
Right. I mean, we have the little article here too at Texas Children's Hospital in Houston. Okay, patients are tested for Rona. Once they get in, no matter what you're there for, you're tested for Rona. So if you're positive, it's like, oh, well, there's no COVID. He's in the hospital. Hospitalization due to COVID. No, they just happen to have COVID. They didn't even notice it was that mild to them. They had no clue. They're like, no, I came in for a broken arm. Can you focus on the arm, please?
Yeah.
I really need this. This hurts.
This is crazy.
But I think we're just testing. We just have more tests available. That's for me. That's what I kind of think. We're testing a whole lot more, so we're getting closer to what the positivity rate was for the first round. Mm-hmm. We just didn't have the testing, and so it's actually maybe minimizing what the death rate actually is, which was already low anyways. Yes, I know we have hundreds of thousands. I get it, but a lot of them I still think are inflated. A lot of them were not due to Rona. They just had Rona, and it was a multitude of other things. And Rona was just the last banana peel.
And I think that this is going to come out pretty quickly, right? The fact that the numbers were inflated is going to come out pretty quickly, and the fact that this death rate is vastly lower than people have been saying is going to come out pretty quickly.
Yeah.
Because you're seeing the media shift so quickly.
Yeah.
I think the media know what's going on, right? I think
their friends are getting it. That's why.
I think they're shifting. They're shifting ahead of time. They're trying to get ahead of what's coming. The reality is
people haven't forgotten. Like, no. I've been watching this crap for 2 years. No.
For sure. No, and you're. I mean, we're going to be watching, right? We're going to be looking. We're going to be talking about the things that weren't discussed. But I think that's why this shift is happening.
But why are we testing for if you have no symptoms? You're just testing to test.
Well, yeah.
Why? What other one do you do that for? What other anything
better,
besides maybe a prostate cancer once a year or other type of cancer where you just get like a little scan just to be sure? That's the only thing I can really think of right now off the top of my head.
This is the science of feelings, James.
Yeah.
Don't talk about that. But it's not just the media that's shifting. It's also the CDC.
Oh, yeah.
The CDC has actually come through and said that we're going to reduce the quarantine time from 10 days to 5 days if you have a positive COVID test.
Yeah.
Right now,
without fever for 24 hours.
I don't know about you. But I sat my butt in my room for 10 days when I got Delta.
I did not.
I sat in there for 10 days. I'm sorry, I sat in there for 12 days because I was still symptomatic after 10 days.
Well, 11 and a half.
But it was... Yeah, well, that's a story for another day. Friends, do not do what I did. Anyway, the point here is this. What changed?
Nothing.
If it was 10 days before, it's 5 days now. What changed? Did the virulence? Well, which we know the virulence of the virus shifted.
Yeah, it can spread easier. Yep.
I think this is a partial admission of the fact that this is not as serious of a virus as we used to have. Right? The Omicron variant.
Did it say why they decided to change it? Did it have like a study they found?
No.
Well, they have like rates though of why they did it, right?
No.
Nick, it cannot be purely for economic reasons.
Yes, it certainly can be for purely economic reasons. They're using, and I'm telling you, they're using the new variant as cover, right? Both the CDC and the media are using this new variant as cover for shifting out of things, and they're saying, well, we did that for Delta and all that because those were more serious than Omicron was, right? But this is purely a political play, right?
It deals with the public, so it is political, despite people saying, like, why are you making Rona political? Well, it deals with the public. The root word for politics
is public health is political. Anthony Fauci is a political
He's supposed to be a servant. He's not, but he's supposed to be.
But the reality is that we've got a 5-day quarantine, which by the way, 5 days is still too long. Right? Still,
and it didn't even say if you couldn't do the 5-day, like, hey, here's some, like, all right, accommodate this way. Like, didn't say, like, hold on, let me see if I can look at it. Like, if it's not feasible, you just wear a well-fitted mask at all times for 10 days after the Okay, so, all right. So if you can't quarantine for 5, you got to go back to 10 and wear your mask the whole time. But you can go back to work where you're killing people or not killing people. Okay. You literally just say the word science, and it's just taken. It's almost like you say a dubious thing. Like, for instance, a religious fanatic, let's just say. Religious fanatic says, you need to stop doing blank because it's a sin, you're going to hell, whatever. And it could be one that's like, wait, where does it say I shouldn't eat asparagus? Like, hold on, this is getting a little weird. It's in there, it's in the Bible. Well, where? Stop trying to play games. It's in there. If you can't even give me a book.
It's like the scene from The Grinch.
Yeah.
Where he's like, oh, yeah, it's the book. It's in the book. What page? He goes, I lost my place.
It's weird. It's weird.
I promise it's in there. It's almost like none of this makes any sense, James. Yeah. It's almost like this is all completely arbitrary.
Well, economics is finally being looked at. I'm just so happy that they are totally going to admit their faults, totally going to admit that they were wrong.
You're gonna be wrong about that.
Well, this only took 660 days since 15 days of slow the spread. That's good. I mean, that's it for a government organization. That's
two
pretty,
years,
pretty
2 years
short.
out instead of 15 days.
Yeah.
James, I will eat my hat, and I don't have a hat to eat if they admit their mistakes.
Yeah.
The reality is that this is all, again, they're going to use the Omicron variant. That's their cover. That's their play moving forward.
It's just really weird because they're saying, like, get vaxxed, get boosted, get all this. Was it going to save me? In the beginning, you will not get it at all. Now, okay, maybe it's whatever. I remember I saw like a video that went like date by date by date. They came out originally was like, 100 to 99% prevented for even getting it. And then every 2 days or so, it would go down 1%. Yeah. And now we're like in the 50s. It's like, I thought it was 100. Yeah, it's not that good. I mean, Israel's doing a 4th booster. Come on, man.
The point is, you're going to get Omicron.
Yeah.
It's going to happen. Accept your fate, and it's going to be the worst cold you've ever experienced. But it's not going to be a cold. It's not going to be the worst cold you ever experienced. You're going to get the sniffles. You might be out for a day, right? You might get knocked out for a day. But we are not going to base our lives over this thing, right? Over this tiny little variant that's not doing anything. And by the way, we're also not going to base our lives on the fear that something else might emerge. Yeah. We're gonna have to deal with that when we deal with it. And I know that you like to say, James, that we're not doing enough, and that's probably true in the state of Texas, right? If we're not quite doing enough,
we spent $7 billion on it.
This is still one of the places where you need to come if you're not afraid of Rona.
Yeah, as long as we can get that monoclonal antibodies, but we'll see.
Well,
but can we throw some shade real quick?
Sure, throw some shade.
I just want to throw some shade because he's fun to throw shade at. Dan Patrick. Looking at you.
Okay. What did Mr. Patrick do?
Got the Rona. Disclosed that he got the Rona the week before, but won't disclose when, like Abbott did immediately after he got Rona. So everybody's going, are you serious? You just kind of been just floating around. You're going to tell us a week later, like, oh, yeah, I had it.
Yeah.
Who'd you shake hands with? Where were you at? What's going on? To be fair, again, it's not that big of a deal when it comes to the actual sickness. But it's kind of like, all right, if the governor set a standard, you kind of got to keep that standard.
If somebody had the flu and did that in my office, you'd be like, you're a jerk.
Yeah.
That's a jerk thing
That's the
to
nicer
do.
thing I'd say to him, yeah.
Well, this is a family show, James.
Well.
Friends, here's the reality, okay? Joe Biden is incompetent. Texas is still a great place. The Rona is over.
Yep.
And the stars at night
are big and bright.
We'll see you next week.